Welcome to the AIM Spotlight Series. I'm Dr. Karina Testa, the owner of AIM Sports Medicine and Physical Therapy in Hermosa Beach, California, and I'm the host of the AIM Spotlight Series. With us today is someone who has been part of the AIM team for just over 5 years now, and he has extensive knowledge and is highly skilled in orthopedic massage and has been working in the field for over 12 years. I've been the recipient of his tissue work, and I can honestly say he is an expert in his field. Welcome, Jay.
Hey, Karina, thanks for having me.
Of course. So I always like to start with kind of getting your background information. So tell me how you even got into orthopedic massage therapy, what you were doing before, and what sparked you to go into this field.
Okay. Well, I'll tell you this much. It wasn't on my radar at all. At the time, I was living in northern Wisconsin with my wife and daughter, and we had been out there for probably 4 years at that time. I met my wife out here in Southern California. It's a long story. We won't get into all of that. You know, it's the history already. But anyways, the weather, in northern Wisconsin and Minnesota, we lived on a border town. So we lived in northern Wisconsin and Superior, Wisconsin, but we worked in Duluth, Minnesota, just a bridge, across the Lake Superior. My daughter was in the Duluth Figure Skating Club. So we spent as much time in Minnesota as we did in Wisconsin. And if you live up there, you understand that. And I had worked at the Palos Verdes School District for about 10 years doing behavior therapy with children with disabilities. When we moved, I worked with a nonprofit organization working with adults with disabilities. And it just happened to be one day on the job out there. I went out to pick up some lunch, middle of winter, for some coworkers and friends of mine, and I slipped and fell on ice and injured myself. I ended up tearing muscle tissue, the quadratus lumborum, which I didn't know. I had no idea what that was at that time in my life. But all I knew is that I was in intense pain and that I was immobilized immediately. And growing up, kind of a reckless boy, I played sports, contact sports like football and lacrosse and hockey. I'd been injured throughout my life in a variety of ways, but I'd never had pain quite like that. And I'd never had pain with immobilization like that, and when I mean immobilization, like it affected how I moved, what I could and could not do for days, weeks, and months after it happened. So I tried to speed this up. So I was guided through my primary care to some PT, and the PT referred me to a massage therapist that had been at work in Duluth for like 15 years and was known to be one of the best. And I had massage literally maybe a handful of times in my life prior to that for luxurious reasons,
Yeah.
And so I went in with an open mind. They said, she's really going to, help you out with releasing some of the tension, working on some of the, the other issues created by the injury. And so I started getting, massage work probably once or twice a week. And from the first session, it was helpful. And that had a lot to do with obviously the skill of the practitioner who later became my mentor.
Oh,
and and I found it fascinating that she was working in areas that I thought had nothing to do with my injury, working on things like my hamstrings, working on like my shoulders. Part of the I had to use crutches for a while. I was bent over. I mean, that injury made me like walk at about a 45-degree angle for a couple of months. It was bad. And, I had to have help getting my shoes and socks on and everything else. Like I said, it was like nothing I'd ever experienced. But the massage and body work, one, I always felt better afterwards. Two, it changed my relationship to the process of that recovery. It was depressing, and as I started to get the body work and started to feel better, incrementally, I started to actually believe, okay, this is, there's a process to this. And if I just do the next step and the next step, I'm going to work my way out of it and it's going to be okay. And so anyways, like I said, that was my introduction to therapeutic massage and body work. It was helpful from the first session on. It spurred a fascination. I would go in there and I would just chirp away, like, why are you doing this? Why are you working there? What is this for? What is that for? There were sessions, I was used to going to a massage therapist and just laying on the table and basically getting a full body massage, just getting, treated head to toe, like I said. And then I was going to sessions and they were piecemeal. Like, we're going to work on this, we're going to work on that. And like I said, at that point in my life too, I was kind of burnt out in my existing career, and I was
Mhm.
kind of thinking about changing directions. And it just so happened that the woman who worked on me, who, like I said, became my mentor, I'll say her name. Her name was Jan. Was also a professor at Lake Superior College in the massage and bodywork program. And she said, if you're so interested and curious about
Yeah.
this, you should come up and check out the program. We do clinics. You can come up there, you can get a student massage, you can observe. And long story short, I signed up and I went to the program. I kept my day job. I went to school at night. And I honestly thought that I would, this would be a side hustle. This would be something
Mhm.
that I would do part-time, maybe a couple of evenings a week, on the weekends and things like that. And it's been a full-time career now for, over 12 years.
Wow. That's a
That's it.
great story. I actually never knew that about you. So thank you for sharing
Yeah.
that. Interesting that you went from a career in helping people with different kinds of disabilities into helping people with physical issues. There's probably a lot of crossover in those two approaches.
Yeah. And honestly, like, it was a very almost kind of natural pivot. It was a pivot nevertheless, but like you said, a pivot in still towards, working with people, helping people, using, the skills that I acquired and learned, and I think, coming from a psychological, I had a psychology major, coming from that background, and just applying that to, like I said, the treatment. Like, I still think today, like, one of the most impactful, things that you get from, good clinical body work is confidence. Like I said, that's what was given to me. I mean, we all know that pain and injuries can literally wear you out mentally,
For sure.
especially if it's
Yeah.
chronic. And to have that change after one session, to feel like, okay, I'm on my way, to see the light, and say,
Yeah.
okay, I'm going to make it through this. And that's really kind of one of the biggest perks of the job, is being able to transfer that, to do that with people, today. I mean, that's the excitement I get from every session, and especially every first session with somebody. Just knowing that, I can enter the loop a little bit and help
Right.
them out, and maybe help them on their way, nudge them in that direction.
It sounds like what you're doing is you're giving people hope there that they can actually come out of this injury or this pain or whatever it is that they're coming to you for, which is different. I mean, that's different than the people that go to a spa for massage or they just go for relaxation. I mean, can you talk to me a little bit about why your work is so different from that? Or maybe at times it is has some similarities, but your overall intent seems to be different.
I like the experience that guided me towards massage therapy obviously guided how I wanted to approach how I practice massage therapy. I did want to help. I did, and I'm no knock to the spa services. There's a lot of great massage therapists out there who do fantastic work, who would, just make you melt. And that is part of my work. You know that too.
I do, yeah.
I do all of this, orthopedic massage, all the techniques, all the tools, all the variations and pressures and things like that, under the umbrella of just good old fashioned massage therapy, right? But I think the difference with, like, the orthopedic massage, and why it works so well in a clinic like Ames, is that it's the clinical brain.
Yeah.
I love it when somebody asks me, why are you doing this, or why did you just do that? And I always chuckle, because they have no idea that in my head there were 6 reasons why I just did that one stroke. And again, it just might seem like one simple massage stroke, but there was purpose behind every inch of that stroke. What muscle did I start with? What muscle did I end with? What nerve pathways did I go across? It's the whole dance, of
Mhm.
working with the tissue, working with the nervous system, working with the body and the brain all at once. I thoroughly enjoy helping people kind of dispel their own fears. And this, you get people who come in, for physical therapy reasons, for massage therapy reasons, and you're hurt, you're dealing with chronic pain, your movement is affected by it, your lifestyle is affected
Sure.
by it. You're not winning,
Right. Right.
and
Good point.
a lot of people come in, right, they're kind of on a losing streak.
Right.
And I think right off the bat, I start to think, how can I help this person start to win? Even if they get off the table, the first session and they feel 1% better, that's better than they felt before they got on the table, which
Absolutely.
means they're going to approach the way they move the rest of that day better with
Yeah.
confidence. You know what I mean? And we know that that's the dance, right? I always like the like, people say, what is sports massage or what it's orthopedic, it's like you do the sport, I do the massage or whatever action or activity it is. It's like I am going to help you feel better so you can help yourself,
Yes.
and that's the big win, right? You get off the table, you feel better, you feel looser, you feel lighter, you feel safer. I'm okay. Doesn't mean that you're fixed. Doesn't mean that you still don't have uncomfortability. You know what I mean? If I could just put my hands on you in one session and fix you, then, you'd be paying me for this conversation. But and that's like I said, that's the big dance is like, I help you help yourself. And I mean, that's PT.
Right.
That it's not gonna, everything we do for them isn't gonna matter if they don't, put some skin in the game too. And so, like I said, with my style of body work, it's every stroke, every inch is purposeful, intentional. And again, you may not even notice that. You may just think this is just a fantastic massage, but I'm thinking about the tissue that I'm working on. And like I said, everything within that tissue, the tissue and the relationships to that tissue, via other parts of the body, regions, things like that, which is again how it was given to me when I was going through that injury, how Jan approached it. Why are you working on my hamstrings when I told you my low back hurts?
Right.
Like,
Right.
just wait and see.
Right.
And it's great. It's great when you see the light bulb go off and people go, oh my goodness, and start to realize that your body is a system. It's not just this broken part, or this painful piece. It's an entire system. And we're going to work on all these pieces and parts. And that is going to make this one part that maybe isn't, doing its best right now, but we're going to get to it. I
Well,
don't know if I answered your question.
no, you did for sure. And I think you touched on a really interesting point is that the tissue work by giving your body this a little bit more confidence to move, then also kind of unlocks the brain to feel a little bit more confident about being able to do more things. And then it just kind of compounds from that. And it's sometimes that unlocking of that connection, our mind, the mind body connection and the brain can get so locked into I can't do anything. I'm gonna be in pain. I can't do this, I can't do that, I can't move. And we become depressed if we're not able to actually move. And I think that's really nice that you blend those two together. You're actually affecting the psychological aspect, but in a physical way. Is nice because it marries what you did in before massage therapy with what you're doing now with your body work. I like
Yeah.
it for sure. So how tell me a little bit about how you even got into the more advanced techniques, because when people come out of massage school, and I don't know about the one that you went to, but there is a kind of a more of a basic routine. It's not to the level that you're at now. So what did you do to become so skilled in some of these other techniques so that you could draw from them to be more effective and intentional in your work?
Well, one thing I still do is just keep learning.
Okay.
And whether that's just, reading, investigating, I mean, right off the bat, like you said, I was given a really good foundation out of school, but you always show up to work one day and somebody comes in and they perplex you. And you're like, oh, well, okay. And, I don't know why you're experiencing this, what's going on. Sometimes we can explain things pretty easily. There's some traumatic event, some injury, some, situation that led to an issue. Other times you're like, huh, it's a puzzle. One of the things that I was taught when I was in school is you're going to be perplexed. You're going to be baffled. And that's when you break it down to the basics. That's when if somebody has a shoulder problem and you don't know where it is necessarily, then just work on the shoulder. Give it a good shoulder protocol and start there. Focus on a region. So I always kind of think regionally. Even if people come in, that's now I have the luxury of having over a decade of experience. So sometimes people come in and they tell me a story and I go, aha, heard this story before. But like I said, just continuing to learn. And I did, continuing education courses in orthopedic massage, obviously in myofascial reliefs, other specific like things where I did courses like things like complex joints, like the knees, ankles. You don't get that when you're working in a spa. People aren't coming into you with ACL problems or coming back from orthoscopic ankle surgery. You get that in AIM Sports Medicine, right?
That's
People come
true.
in and yeah, they have a neck issue that they want to deal with, and maybe they have some low back pain, but they're also dealing with these other complex joint issues. So that was the kind of stuff that I've always been like, well, then if I don't know it, investigate it, find out. And I got a great resource because I have teammates, at
Right.
AIM, physical therapists, chiros, a bunch of smart people with a lot of experience that I can always lean into. And that's, I've never, tried to get my ego out of the way. If I don't know something, then I say I don't know and I find out why. And I ask the people, around me if they have anything they can help me with. I've never wanted to well, for lack of a better term, I've never wanted to BS my clients or patients. I
Hmm.
wanted to be upfront with them. I always want to
Yeah.
tell them why I'm doing what I'm doing. And maybe I don't know what's going on. So we're going to figure it out. We're going to find out. I'm going to look for resources. And one of the simplest pieces of advice that I got early on was to investigate the criticism of massage therapy,
Okay.
because
What do you mean?
massage therapy, obviously there's a history with massage, masseuse, massage parlor, things like that. And sometimes that gets thrown into the mix. And, I always wanted to make sure that when I put my hands on people, that I knew where I was, what I was doing, and why I was doing it. And that I was doing it for them, right? That it wasn't
Mhm.
for me, that I wasn't just going to do the Jay Wade 30-minute back routine or this 60-minute, that I was going to, treat you with the tools that I learned in school, the foundational schools. And then, of course, the tools that you learn on the table. I mean, we get aha moments, right? You're
Of
treating
course.
somebody, you do something, and they go, whatever that was, and
Yeah.
you bookmark that. And the
Right.
thing
Right.
about that is, if when I bookmark things, when I do a technique, when I do something to someone, and it, helps them, it whatever changes things, then I try to figure out why. Why did that thing that I do help you? Well, lo
Yeah.
and behold, that area is rich in nerves. Oh, there's this or there's that, and that's the kind of thing is I've always been curious. I've always wanted to just investigate. So again, if you ask a question, I can give you the best educated answer or hypothesis based on education and experience that I have without the woo, without, BS. And if we're both confused, then we're gonna figure it out.
I like that. And that kind of goes into my next question of, if someone is watching and they don't really know what is the difference between a massage that I might get at a spa versus the massage I might get with Jay Wade, how would you kind of break that down in a more simple term for them to understand that the type of work they're going to get with you is different? Not we're not going to say better or worse, we're just going to say different because I think it hits different needs when they come to you versus when they go to a spa or to a massage, clinic, if you will.
Well, I think the biggest difference is that I'm going to be very specific and targeted.
Okay.
People, again, that's the beauty and the challenge of working in a place like AIM is people come in and they have specific issues.
Mm.
And I was at work yesterday. No two sessions were alike. I had no session. I did not have one session that was like a full body session. I had one session that was 90 minutes, all posterior chain, from the base of the skull down to the feet, working with a patient with a Harrington rod that she's had in her body since she was 9 years old,
Hmm.
and the tension and the issues that have come through that. I mean, that's really cool for me. Sorry, I get weird on stuff like that. I get to
Yeah.
put my hands on somebody who had a procedure done 40 years ago and how she's evolved physically because of that procedure and this piece of metal in her body. You know what I
Exactly.
mean? And it's
Yeah.
great because I get to, I mean, that's the stuff I learn from on a daily basis. But again, very specific to that individual, individual that day. I have people that come and see me every week, and I don't do the same session with them week to week.
Hmm.
Maybe they bring their one issue that they always want me to kind of clean up or groom, as I say, and I know it's kind of a word with some negative connotations, but really, I think a lot of the people that come in regularly, I'm grooming tissue. If they have shoulder problems, neck problems, low back problems, and they come in on a weekly basis or a monthly basis, I'm keeping that tissue supple and loose, and mainly psychologically, again,
Yes.
keeping them feeling good. so they
Right.
can go to the gym, so they can go to the pool, so they can go to the golf course or the pickleball court, so they can keep doing the things that they want to do. I love the just tailored approach. It's like people come into my room and it's like in my head, I just have, I got a tool chest, I'm going to listen to you. Where are you today? How can I help you? One of the things that I've done in the 10 years is I used to always ask, and I think we're kind of trained this way, where does it hurt? I
Yeah.
always try to remember now to ask people too, what's feeling good?
Oh, that's a good
How's your
point.
body
Yeah.
serving you?
Right.
Because if you're
Right.
always focused on the negative, you forget that, like, yeah, you've got a problem with your calf, but the rest of you is doing really, really good.
Yeah.
And that also goes a long way when it comes to rehab and even prehab if somebody has an issue that they know might flare up with activity or exercise. So tailoring each session specifically to each client, providing them, varied services, albeit with the same set of tools, but what tools am I using today? What pressure am I using? And that changes within a session, within a region. I'm going to do the back of your arm differently than I do, your shoulder or your lower back.
Yeah,
And
for those of you that gives, that was an inside joke right there. I am extremely sensitive on the back of my arms and on my calves, and Jay knows it.
Right. That's the cool thing about working with regular clients, having a
Right.
repetitive business, is I do know it.
Yes.
And it's fun when I get to put my hands on somebody and go, oh, what's going on here? And you can feel that, and that's not something that I had when I first started. I feel for the students who come out of, a massage school, and they're in the first 6 months of their first year. And it's weird. You're like, people say, don't you feel that? And you're like, no, I don't feel that. But when you put your hands on enough people and you've worked through a variety of issues, pathologies, injuries, you do start to get a feel for things.
Yeah.
And that's cool because I remember struggling with that. At the beginning of my career, people say, feel this, feel that. I'm like, I don't know what you're talking about. It's like, I feel things, but I don't, I'm not feeling that. But now it's like, I can pick things out, in a weird way, see with my hands. I think in a lot of ways, I try to think sometimes, and this is where it gets a little silly, but I'm not a musician, right? I have a guitar and I play poorly. But I think of like when people come to me, I think of like we're gonna put together a song today, you know.
That's a really cool way to look at it.
Well, and so what's this song gonna be?
Yeah.
What are you bringing to the table? I had a client come in, a regular client come in last week, and she kind of listed off a few parts of her body that had been bothering her, but there was no activity or increase or decrease in exercise or activity in her life recently. But then she went into the travel that she's had with work, the issue that she's had within her family, some elder care issue, which I think we've all experienced can be extremely overwhelming and stressful. So
Sure.
that's
Yeah.
the stuff that like I start to dial in. I'm like, okay, you're stressed out, you're exhausted, you're carrying tension. Maybe not so much because of what you did at the gym, or maybe not so much what you didn't do at the gym, because we know that
Right. Right.
sometimes also can be a culprit. But maybe you're just, your nervous system is just bound up right now. And
Mhm.
that's permeating the tissue. And that is creating discomfort and pain. And that, again, that changes the song. I'm going to dial up a little bit more of the R&R in this session. It's going to be a little bit more soothing and hypnotic. I'm still going to move tissue, and that's, I get to kind of combine that song, and change it up again. It's going to have a bridge, it's going to have a chorus, an intro, an outro, and sometimes if I'm doing really deep work, it's going to have a breakdown,
Yeah. Yeah.
and I think most people who have had body work know that at times it's going to be uncomfortable.
Mhm.
It's going to hurt. It's going to hurt when I push on you or I squeeze something, I pull something. And you've had work done by me. I also try to, and this is where I wrap everything up in that like package umbrella of just massage therapy. If I know that I'm going to have to apply some deep techniques to you, some pressure that's going to be uncomfortable, that's when I start to twist the dial around to like maybe some of the longer, slower flowing techniques. So that's when the massage therapy mixes science and art,
Sure. Yeah.
so I can try to calm you down while I do some of the nitty gritty. And that's, the cool thing is a lot of people have had the work done by me. they'll say, it was like, is it always that intense? But it's intense and they still feel euphoric and relaxed. I'll work on people for 90 minutes doing some pretty deep work. I come out of sessions sweaty and everything else, and they get off the table and they feel like they're in la la land, and even though in my mind, I just went, like they were just through the grinder,
Right. Yeah. Well,
but
and I know you like to say that you work with the nervous system as much as you do the muscles because pain lives in both. So tell me a little bit about what some of the techniques are that you do that help with the nervous system and what someone might think of, what that means to the person that's on the client that's on the table.
okay, I'll get back to the art then in a little bit. But again, the first thing I think about is, I think a lot of times we think about massage, we always just think about the muscular system,
Right.
right? That red tissue that you see on the diagrams, in each room. And, in the rooms that I work in, I've got the nervous system. I want to, yes, your body is covered with muscle tissue, but what translate that message from your muscle tissue to your brain are the nerves, running through it, permeating all of it. And we all know that you can irritate a nerve. Your muscle tissue could be a-okay, but you could irritate a nerve for a variety of reasons, and that will create tension and immobility. We all know the Frankenstein neck, right, where we've irritated a nerve and we can't turn. So I know immediately what nerve pathways I'm going to follow, and of course that means I'm manipulating muscle tissue, but that's not at the front of my mind in that session at that time. Now I'm thinking, okay, we're focusing on the nerve pathways, the nervous system. We're going to try to calm these down. And again, understanding that it's going to be uncomfortable. That's one of those ways where I can start to use the art of massage therapy. And I'd start to do things like very repetitively in sessions like that. There are certain sessions where I'm not, I'm just working, right? And then in sessions like that, I start to do things in like threes, sixes, nines, because repetition is hypnotic and it's soothing. And if somebody comes in and they have a burning hot nerve, that's angry in the neck and going through the shoulder and down into the triceps, I can't just go in and hammer away. I have to go in and kind of gently enter that loop, right? And that loop, going through the body is pain, fear, immobility, pain, fear, immobility. If I just grab, a piece of muscle and start to just sift and lift, then they're just going to go pain, 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 and get more scared. So I have to kind of insinuate myself, a little bit, gently, albeit, I mean, you guys know me, I'm kind of a big stocky guy, but I'm going to move that tissue, but I've got to do it in a way that you calm down, that you take some deep breaths, that you accept, that yes, this is going to feel uncomfortable at times. But again, like I experienced when I had my injury, it's a process. We're going in the right direction. It might get a little hot while I'm working on it, but I guarantee you later that night or the next day, you're going to feel better. So nerve pathways, the connections between the brain, the spine, right? One of the things I love to do in almost any session where I'm working posterior is just trace the spine for a while, just to kind of tickle that information highway, knowing that all the nerves are stemming from there, right? And just kind of go down there with thumbs, go down there with forearms, palms of my hand, kind of just grease that, nerve wheel, so to speak, before I come back to maybe a neck or a shoulder. Because that, again, that gets the body and the mind primed for the work that I'm about to do. So it doesn't it's not like I'm just running in, and attacking somebody. When I first started doing massage, I did a very seek and destroy kind of style. It was all like, I was all anatomy focused. I was all pressure focused. I was convinced like I could just break things up. And now I'm thinking more like, we're going to dance, like I said, we're going to write this song. We're going to dance together. Now, I'm not going to attack this, break this up. We're just going to go in and we're going to, it takes two to tango, right? So we're going to, do our thing. And that's cool. The cool thing about Bodywork too, is that, I get to give people undivided attention.
Yes.
For 30 minutes, 60 minutes, 90 minutes. I have a 2-hour session tomorrow, and people go 2 hours. How do you do that? I'm like, I love that,
Yeah,
because that's
gives
good for
you,
me too.
yeah,
I mean, we're talking, I mean, I love what I do, and now I've got 2 hours to work on your entire nervous system and muscular system. That gets me going. That excites me because I know that that person is going to be better for it. And, you know, probably the rest of us are too, as well, right?
right. So who would you say then is your typical client, which I know is a very broad term because most of the people that you work on at AIM have some sort of injury or chronic condition or whatever. So tell me a little bit about the different types of clients that are typically on your table.
I would say okay, well, obviously the largest population period were just the baby boomers, because they're the largest population period, right? So you've got that group of people who are, of an age where they're just organically, changing. I don't like using the term breaking down, at least not to them necessarily, but you know what I mean? It's like their joints are changing, tissues are not the way they used to be anymore. And that's, not just muscle, but you're talking tendon and cartilage and all these things. So there's a lot of people that come in that I work on who are 65 years and up, who are still active, who are still going to the golf course, going to the gym, getting in the water, playing pickleball. We all know that,
Yes.
pickleball is taking over, still doing the deal and still want to. And, accept that with that, is there's going to come some pain and some discomfort. A lot of people coming in great shape, but with arthritic conditions. Again, going back to the joints, work with a lot of people in that age group, a lot of hips, a lot of knees, and a lot of men with shoulder issues.
Interesting.
And then other than that, I mean, there's, I guess the term weekend warrior suffices, even though people, especially up here, that's the benefit of Southern California, right? It's not like when I was living in Minnesota and Wisconsin where it's winter for 6 months. Out here, people can be active like year round and
Right.
active
Right.
in ways that they don't even consider to be active anymore.
Yeah.
Just going for a walk on the beach, going down to the strand and riding a bike with a buddy or something like that. People are moving, you know.
Right. Which is a
So
good
there's a
thing.
lot of people who out here who are, going to the gym, who are taking care of themselves, who in a variety of ways. So and if you're going to the gym, you're going to disturb tissue. You're
Sure.
going to pull muscle. You're going to, I mean, especially if you're working out hard, I mean, you're breaking tissue with a purpose, right? That tissue is going to rebuild bigger and stronger. And that's what I start thinking about again. A lot of the clients that come in, it's like, we're cleaning up. We're cleaning up areas. I'm getting into areas and I'm not just moving muscle tissue and stretching tissue and creating space, but we're moving the blood. We're putting oxygen into areas. We're hydrating tissue. You get the athletic, the competitive athletes, the runners, a lot of water people up here, a lot of surfers, sea kayakers. I've got this couple that I work with that, I mean, like a weekend for them is like kayaking from, San Pedro to Catalina and back, and
Wow.
yeah, they're like, what did you do? And I'm like, I watched football all day, and so it is interesting because and that is one of the coolest things about working in a clinic like AIM. You get the high school athlete to the 87-year-old patient client, who are just trying to keep moving the way they want to keep moving, if not get better at the same time.
Right.
And how can I help them? How can I be part of the team in that, to get them again moving better than they did, feeling better than they did when they got on my table, before the end of that session. So I mean, it's funny because movers and shakers, cover the age range, right? And
Right. Right.
it's such a diverse group of people that I work with. It's and of course, then again, you get the people who the desk jockeys, the people, especially since COVID, where so many people now started working from home. And like I said earlier in this conversation, sometimes it's not what you did at the gym, it's what you're not doing at the
Right.
gym. They
Right.
wonder why, they've got so many fires going off in their shoulders and neck. And I was like, when was the last time you got up and moved?
Yeah. Yeah.
But chin down,
Yep.
scrunched
In the
over that
computer.
computer, staring at
Yep.
the desk, and then they wonder why they go to play tennis with their friends on the weekend, and after 20 minutes, they feel like they need to go to the hospital. But
Right. Well, you also mentioned youth athletes. And I know you've worked a lot with youth athletes. Tell me a little bit about the type of athlete you've worked with, what you've helped them with. Why would someone who is, high school or even younger even need to come and see you?
Yeah, so going back to Minnesota, obviously working with a lot of ice sports, hockey players, figure skaters. My daughter's a figure skater. There was a time in her life where she let dad work on her. Now she's 19, it's not that cool anymore. But I worked with some guys who played high school hockey in Minnesota who are now in the NHL, which is pretty cool, and
Yeah.
these are guys that went on, a couple of them I worked on when they were in college up in Duluth, Minnesota, and one's with the Blackhawks now, one's with the Winnipeg Jets, and that again, a lot of that was just maintenance work. These kids, high school athletes, I think sometimes they get this, the idea is, oh well, you're young,
Yeah.
so
Yeah.
it's just push, 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 without the recovery, without even some of the it's prep. I mean, I'm always baffled with the kids that are out there swimming, or playing volleyball or whatever, who don't have ample prep time. And I'm not trying to be critical of judges, I mean coaches and stuff like that, because I'm not a coach. But you get a lot of these kids who are just used to, like, getting up in the morning, going to the pool, jumping in, swimming their what off, and then going to school and coming home, eating, and then going back to the pool. And I don't care if they're 14, 15, or 16, they're going to be exhausted.
Right.
Their tissue is going to be, they're going to be operating in a deficit. They're going to get in the pool, and they're not going to be 100%. And just because they're 14, 15, and 16 doesn't mean they're not going to get cramps. They're not going to strain tissue. They're not going to create damage. I think there's this idea that your youth is just going to cure things. You're going to go to bed
Right.
at night.
Right.
You're going to
Right.
get up the next day and you're going to feel fine.
Feel
I
fine.
know that from personal experience with my daughter, growing up with her skating, that there were times where, like I said, she would go to the rink and she's bringing tissue that's just not going to give her 100%. And it's going to not just affect how she performs and how she skates and how she practices, but more than likely, it's going to create more tissue damage. So, a lot of the kids like that I work with, again, we get to real specific stuff. Like, we're talking about swimmers or hockey players, then obviously you're working on, hip flexors, adductors, a lot of leg work. With the swimmers, a lot of shoulder work. You're doing,
Shoulder.
extensive shoulder protocols, getting all 14 muscles of that shoulder. And again, trying to grease the wheel. If they can't get the rest and recovery, and maybe proper hydration, from their day, then hopefully I can give them a little bit in
Mhm.
that
Mhm.
60-minute, 90-minute session. I can get into that tissue. Like I said, I can soften it. I can create some space and really, like I said, open up space so fresh blood and oxygen and lymphatic fluid can get into those spaces and kind of rejuvenate those areas. Because you and I both know that what sore damaged muscle tissue really, really, really wants, or tendon, is just good blood flow.
Right.
Keep the
That
blood
is,
flow going
yep.
to these areas.
You stop it and
Otherwise
we're in
they're just
trouble.
going to stiffen up,
Yeah.
and you're walking around trying to use beef jerky,
Yeah.
instead of pliable, elastic
Right.
muscle
Right.
tissue.
Well,
But
and then now switching gears to the other end of the spectrum, I know that you also have some specialty with working with actively aging clients, and people are kind of at the other end of the spectrum in terms of what they can do athletically, but still that you can still work with them and respect the maybe the more gentle side of what the tissues need.
yeah, again, I mean, that goes back to just the fun, diverse clientele that I get to work with. The people that will come into my room throughout the day always provide me, a variety of ways to provide the services, that I have to offer. And I think, when I'm talking about, like how did you call them? What did you say? Actively.
Actively aging.
I like that. You get to a point where your body's not your best friend anymore, right?
Yeah.
And that you could be the 70-year-old retiring Pilates instructor, or maybe the 87-year-old, maybe you're not active at all, but your body is maybe in your head at least you might think that it's actively fighting against you. And that's when just kind of, I mean, people have been putting their hands on people to treat them for thousands of years. I mean, you can look at the hieroglyphs in Egypt, and you can go back to ancient Chinese medicine. Just being able to put my hands on somebody, and then again, going back to the loop, how can I make you feel like your body is an ally again?
Yeah.
Maybe we're not doing deep tissue work, on the 87-year-old client, right? No need for that, right? But I can still move tissue. I can still send messages from your body to your brain that you're doing all right. You're doing pretty good. And sometimes just that good old fashioned hands-on human touch, for somebody who thinks their body is out to get them, or isn't, like I said, working for them anymore. You get to be a certain age sometimes, and you see nothing but red lights ahead of you, and I try to go in there and see if I can play with the lights a little bit, maybe give you a couple of green lights. It's fascinating sometimes working with people in later life, because they've lost people. They know people their own ages who maybe don't move well at all, maybe can't, maybe are kind of confined, so to speak.
Right. Yeah.
And so I always remind the people, who were on my table, whether they're 77 or 87, it was like, but you're here.
Right.
You're already winning.
Yeah.
Maybe you didn't make it as fast to my treatment room as the client who was before you, who's 30 years younger than you, but you're here and you got on the table. And, we're going to adjust some things. Maybe I'm going to, sometimes with some of my aging clients, we do more sideline techniques. So they're not just on their chest the whole time. It can be difficult sometimes for breathing and things like that. And sometimes it's difficult for just neck positions. So there's always some tools and tricks when it comes to body positions, pillowing, things like that. But I think sometimes, the way I think of all of my body work is it's like a guided meditation, like a physical meditation for you. I want you, I mean, I know that sometimes in my sessions, people doze off, they zone out. But I want you to focus on what you're feeling, what's happening, what are you feeling? Not what am I doing, but what is the information being sent, from my hands to your body to your brain, and if you're 87 years old and, you've got maybe some fear of falling because of a history of falling, or you're seeing 90, coming down the line, you get on the table and you get 60 minutes or 90 minutes or whatever of pleasant, comfortable body work. Even some of the people that I work on that are age, though, I'm still going to put in some pressure. They still feel it, and that's almost rejuvenating to them. It's like, and I'll say things like, you are robust.
Yeah.
You're not just some broken thing. I don't know. I don't know if I answered that question.
No, you did. You did. Tell me a little bit, just give me some of your success stories, some things that you were pleasantly surprised that you really had a great impact with.
I think a lot of times like similar stories to mine that kind of brought me to this. The people that come in that have had an injury and it has just interrupted their life, their lifestyle, and it's been constant, chronic. I've had people with severe back injuries. I've had people who have had to have surgeries, cervical stenosis, a lot of spinal fusions. Obviously, getting people onto the table and helping them move through rehab. And understanding the different phases of those processes, that phase 3 is not going to be like phase 1. Phase 1 is going to be pain management, scar management. It's going to be, you got this. I've been working with a patient the last few months. He had Achilles, he had ankle surgery related to Achilles damage for 2 years ago. He had to have arthroscopic surgery to the same ankle a little bit more than 6 months ago, maybe 7, 8 months now. So that ankle has been at the forefront of his discomfort for the last 2+ years.
Yeah.
And he's looking for a win, right? Yes. And, it's going to sound weird, but the beauty of the arthroscopic surgery that he had was that it set the scale back to 0 again. It's like, okay, we've got to bring it back down to 0, come back in. Once he was cleared post-surgery, he came in, he had that nasty scar on the side of his ankle. and I went right to the scar, and of course I didn't manhandle, you get in there and you just start to desensitize an area. You just
Mhm.
start to work delicately on that area. And then we know that that scarring is obviously going to create mobility issues. That's going to go all the way up that chain, the
Yep.
calf, the quads, the hamstring,
Right.
the hip, the low back. And that's where my massage therapy techniques go. They don't just stick to the scar, right? And we go up there. And it's, I've been working with him now, and he's good for him is he stays on top of it. And he's got it coupled with PT, which is also the cool thing about working at AIM. People are coming in, they're getting their exercise prescriptions, on top of the, manual therapy, the massage and body work. So they're getting their tissue manipulated and worked on, and then they're getting up and they're working on it too. But this guy now, it's like he comes in, his ankle isn't the problem. It's the atrophy that he's had to, fighting through for the last 2 years. It's the, now suddenly his calf is growing, his hamstrings are growing, and he's getting tension in places they didn't have tension. And he's feeling it in his hip and his low back. And kind of going through that whole story is cool because again, I get to be part of that recovery process. One of the, I mean, another recent one is, people come in and they've already diagnosed themselves. I know you know this too.
Yeah.
They go into the
Yeah.
Google machine, right? And the Google machine, always gives them the worst case scenario. And I love it when people come in and they're telling me, oh yeah, I've got frozen shoulder, right? While they're moving their arm and raising their head above themselves. And in my head, I go, you don't have frozen shoulder. But of course I'm not going to say that right off the bat because I don't want to make, I don't want to be rude. I'm like, oh, okay. I'm thinking you probably have a supraspinatus tear, something like that, but being able to help people dispel those fears, people who come in and think, oh, now I'm never going to be able to play not this pickleball tournament that I wanted to play in, this, I'm done. And they start to retire. They start checking off boxes. And to get them on the table and be like, okay, we're going to work on your shoulder and we're going to work on your other shoulder. And this is a little trick that I do sometimes, especially when people come in and they're just focused on this one part of their body that is broken, that causes pain, that isn't working, isn't doing what they want. I always try to work on the opposite and remind them like, hey, look, this is good. This feels
Mhm.
great. Oh, this shoulder over here, you've got good scapular mobility. And that's part of the psychology of it too. I'm not making it up.
Right.
I'm
Right.
telling the
Yeah.
truth, but I'm also showing them that this can be like that.
Right. That
It's
back
like,
to the hope.
right. And so here's the good, here's the not so good, but it's okay. I think really, I mean, aside from helping calm tissue down and calm the nervous system down, dispelling fear
Yes.
is probably one of the biggest things that we do when it comes to musculoskeletal pain, right?
Mhm.
And one of the most interesting things that we face aren't necessarily the people who come in with an acute injury, right? It's the people who've had the acute injury, had the PT, or had the surgery, and 9 months later, they're still afraid to get out of their truck,
Right.
because they're afraid their
Yeah.
ankle's going to blow up,
Yeah.
and and that's where again I'm thinking, okay, this is a nervous system, brain, system driven massage type session,
Right. Right.
you're okay. It's funny how sometimes I feel like I'm just like it's a pep talk,
Mhm.
while I do
Sure.
massage, while it's
Yeah.
body,
Yeah. Well, and I think you touched on something that I just want to circle back to real quickly is that the work that you do is complementary to a person that's actually going through physical therapy or going through some kind of rehab that it marries very nicely because sometimes in physical therapy we're so focused on the area that has been injured and making sure that we give our attention to that area and that specific thing and we don't have time or we don't have we've done so much in that area we can't address the compensatory tightness in the opposite hip or in the shoulder or in the neck because of some of these other psychological
yeah
issues and it's such a nice ability to be able to have an orthopedic massage that can address that and it just makes the healing just kind of exponential I think
Yeah,
I
I
think
think the interesting thing too is like, I get to hear, I work with a lot of clients, patients who come to AIM and go to PT and see me, and you guys aren't necessarily doing the songwriting like I am, right?
right
Like when
right
you work on
you
a
guys we're getting
client,
to business
when Amy, does manual therapy, you know, Amy gets right to it.
Right.
There's no, 3 strokes here, 6 strokes there. There's no little, let me play a little game here, let me hypnotize. And that's the beauty of the massage,
For sure.
therapy world, is that I get to apply these orthopedic techniques that you and I would use, that,
Sure.
very
Right.
similar, but I put it together and differently, right? I package it
Absolutely.
differently,
Right.
which is why I think people will say, wow, that was intense, but comfortable. So many people would say that was the like strongest, but like gentlest deep tissue session I've ever had.
Mhm.
And because that's the marriage of the orthopedic clinical brain and techniques, and with the massage, skill and art. And somebody can come in after having one of the PTs work on their piriformis for 15 minutes, and I'm going to package that into a 60-minute or longer session, right?
Right.
So they're going to get all this other body work, and they might not even notice when I sneak up, and put an elbow, into their piriformis and manipulate their leg, and they're like, oh, it just hits differently, right?
Right. Right.
It's not like what Dr. Rob does or what somebody else does, but that's what I get to add to the bodywork world,
For
right?
sure.
I get
Yeah.
to add that whole massage package, right?
I
And
love
that's,
that.
I
Yeah.
think, what's cool about, going to AIM. You've just got a collection of body workers, all, with the same aim, pun intended, in mind, but all these different like techniques and styles and modalities, the PT, the chiro, the soft tissue chiro, the acupuncture, and all geared towards, again, getting people, feeling better about moving,
Right.
and, helping them help themselves. There's nothing better than getting someone to realize that they can do more than they thought they could, at whatever increment that is.
Sure. Yeah.
1%'s a win,
Yeah.
and that's
Yeah.
always what, we're shooting for wins. So it's, and that's, there's a lot of the, people that come in from PT will then expand. Maybe they're going to PT for a shoulder issue or whatever, but now it's like they've come to me and I've done some shoulder work with them, and they'll say, they say that, from, my lower back bothers me from time to time too, or sometimes my calves, this and that's, I'm like, perfect. It's like, well, let's put it all
Let's get
together.
there. Right. Right.
Let's work on the shoulder. And that's what most of my regular clientele is like. The people that come to me, weekly, monthly, for years, are the people that came to me. They had one specific issue. They had something that was really troubling at a point in their life, a shoulder, a knee, a neck, or whatever. And over time, I've then applied, the tools and the skills to other parts of their body. And now the people come in and let's work on this or these or that. I had people that I started working on. We did very specific, focused regional work on, for weeks or months. And then one day they said, one of these days I'm going to need to do like a 90-minute or, whatever. And I'm like, yeah, do it. And then they get one of those. And now the hook is really set. They're like, holy cow. And it's like, yeah, we can work on everything. It doesn't have to just be that bad shoulder. We can work on the good stuff too,
Yeah. Yeah.
and the beauty of it is, if they keep coming back, then they're probably going to keep doing the things that they love doing, and may even get better at it,
Yeah.
and then
Yeah.
that's just high fives all around. So
That's great. That's great. Well, Jay, I think I really enjoyed talking with you about this. I think you've shed a different light and a different perspective on what orthopedic massage can be. And I think the general theme is that it gives people hope, and it gives people more confidence, and gives them a chance to move in a better way so that they can live their life better. I think.
yeah,
I appreciate it. Thank you
awesome.
so much for spending this time with me.
All right, thanks for having me. It was a joy.
Thank you.
Really.
Thanks.
All right.